In New Brunswick HealthLink's model, what the program allows for is it allows for patients that don't have a permanent primary care provider to not just seek episodic care. They don't have to rely on emergency rooms or walk-in clinics. The program allows them to have continuous oversight of their medical care without necessarily being attached to an individual. So it's really sort of geographic-based attachment. So I think that what New Brunswick HealthLink does really well is we really maximize the scope of everyone that works within the program, and we also maximize clinicians' time.
I think that there's some things that really stand out about HealthLink. One is the adaptability and flexibility of the program. So we have physicians who provide a half day every 2 weeks. We have physicians who travel through multiple zones in the province. Where HealthLink is provincial, it's easy to pick up and go. For me specifically, the flexibility to set my own schedule, the turnkey style. So we walk in, all of the staff are paid for, all of the equipment is there that we need. We do our day of work and we go home, and we don't have any paperwork is really another standout feature of HealthLink. So what they're doing is basically any test I order, any consult I write is for HealthLink. That is the providing doctor. And so everything returns back to HealthLink, and they have standard procedures and algorithms that RNs who are trained for it will basically triage the returning data. And that means if I'm on vacation, I don't have to follow up a CT I was looking for the next week. That means if there's a consultant requesting additional information, I'm not tapped to respond to that. An RN can respond to that. And any critical care results, as opposed to coming directly to me, go to a provincial line where they can be addressed promptly. And so really you do work the hours you're scheduled, and when you go home, you're done. When you go on vacation, you're done. So the flexibility to engage with as many hours and across the province and without paperwork, which is a real soul crusher at times in healthcare. So a lot of the patients I'm seeing are just really grateful to see anybody. So there is a lot of kind of positive coming out of that. They're also really sick, a lot of them, and a lot of them don't have the primary care they need. And so the ability to step into that uncontrolled diabetic who hasn't had anyone taking care of them for 5 years and say, hey, look, you've got somebody now. Through the program, we'll be following you until you get a family doctor, and we'll be able to provide that care. That's really affirming in terms of my practice.
I think that this is an opportunity to take a look at what you really want to do and what brings you the most joy in practicing medicine. NBHL is really there to support the rest of the health system. We're not there to compete, we're there to collaborate with the system, and at the core, that's our mandate, and that's really the core of our values, is to be there to help maximize the system, to help enable high quality care for as many patients as possible.